Hi, and welcome to Outbreak News TV. My name is Robert, and today I want to take a look at the COVID-19 situation in the Philippines, a country I know quite well, and I always keep a very close eye on the developments going on there. And as of today, the country has reported 14,319 total cases nationwide, and these are all confirmed by real-time PCR performed by a lab that was certified by the Department of Health and the Research Institute of Tropical Medicine. So they had 284 additional cases today, and the total fatalities so far in the Philippines is 873. So let's try to break down some of this stuff. This actually came out on Friday, so it's slightly dated, but it has some important information on it. It says that about 64.5% of cases reported are from the National Capital Region, right? The Manila area. 64.5% of cases. This is followed by Central Visayas, right? The Cebu area with about 14%. Calabarzon and Central Luzon follow. Now, of the fatalities, about 2/3 are male. And of the people that have died as far as age, I came up with about 85% are 50 and older, and somewhere around 70% are 60 and older. 3/4 of the fatalities are from the National Capital Region, right? The Manila, Quezon City area. Let's see what else we got here. And we can take a look at some of these graphs and get a better picture. So here's the fatality, 65% are males. And this is just the distribution of cases, and it slightly favors males also. And here's the fatalities right here. So about 37% are greater than 70 years of age. Greater than 60 years of age, you're talking about around 70%, and greater than 50, it's somewhere in the ballpark of 85%. And here's a map of the Philippines, and you can see the darker areas. This is the National Capital Region: Quezon City, Manila, Makati, Pasig, Paranaque, etc., etc. So clearly that is the hardest hit area. And then right here, it looks like this is the Cebu area, which is also hard hit. And there's a couple areas down here in Mindanao that are hard hit also. And they have some different response things happening. This includes in Pangasinan, they placed Barangay Dupac on total lockdown for 14 days after some cases. Concepcion town in Tarlac was placed under 24-hour extreme general community quarantine after a couple cases. In Cebu City, they lifted the total lockdown in Barangay Luz after 43 days of being in total lockdown. And we're going to talk about that in a little bit in the video. And down in Mindanao, South Cotabato placed Polomolok municipality under modified enhanced community quarantine for 7 days after a case. So the Philippines are taking some pretty strong actions against cases and trying to avoid little community outbreaks. Now, getting back to work, the Department of Health, they recently said, with the easing of community quarantine, employers are encouraged to follow particular law concerning particular guidelines about whether you need testing to go back to work. And according to the DOH, employers are not officially required to get their employees tested for COVID-19, and neither is it expected that employers require their employees to get tested. The department mandates the screening and monitoring of employees to promptly address those showing symptoms. We would like to clarify that we are not requiring employers to test their employees, but we do encourage employers to advise employees to undergo testing if they are showing symptoms. This was from Undersecretary of Health Maria Rosario Singh Vergere. Testing remains to be targeted to those that are symptomatic. In battling the pandemic and protecting against the virus, the personal preventive measures such as physical distancing, hand washing, and cough etiquette will effectively hamper the transmission of COVID-19. And then they also put out some guidelines for malls, right? These are places where you're going to have a lot of people potentially getting very close together. And in this press release from the Department of Health, it says, with the easing of quarantine restrictions in different parts of the country and reports of shoppers flocking to malls the previous week, the Department of Health and the Department of Trade and Industry strongly reminded the public and mall operators in the country to strictly implement the official guidelines on mall operations. Again, this Health Undersecretary Vergere, in a special media forum on Sunday, stressed the importance of maintaining the minimum health standards, particularly in public spaces such as malls and department stores. And there's some Tagalog words here, so I can't read that. So according to DTI Undersecretary Ruth Costello, she said that measures include strict monitoring of foot traffic and enforcing of physical distancing inside mall premises. Malls are also advised to limit the number of people inside the malls or shopping centers or even the individual stores by reducing the number of available customer seats in shops, reducing open entrances, creation of one-way flows inside premises, and limiting elevator access to senior citizens, persons with disabilities, pregnant women, and that pretty much completes that statement. Air conditioning inside malls are also to be kept at 26 degrees centigrade, and free Wi-Fi for mall goers is to be suspended to discourage people from staying and loitering. So the DOH over in the Philippines is concerned about this, the gaggle of people that are going to appear at malls, because they've been on lockdown for a long time and people are ready to get out. And but there are some concerns about people seeking out the malls as a place of refuge and getting out and enjoying themselves. So, okay, let's take a look at some of the help the Philippines is getting. And according to UNICEF, they've mobilized $3 million in aid to the Philippine government's COVID response. UNICEF Philippines scales up its support to the government through the DOH in its efforts to address the COVID pandemic. In support of the country's battle against COVID-19, UNICEF Philippines recently procured supplies which include 72,000 sets of PPE for health staff, 450,000 masks, which include both N95 and surgical masks for health staff, and 500 PPEs for cleaning staff. The PPE kits for health workers include face shields, masks, gloves, coverall suits. The cleaning and disinfection kits include soap, mops, buckets, dippers, alcohol dispensers, and on and on. UNICEF also provided 64 multi-purpose tents to scale up ward capacities for hospitals in affected regions. So a total of $3 million have been mobilized to date through UNICEF. So they're really trying to take some measures to get some of these hard-hit patches of the country under control. And they say here, this is Health Secretary Francisco Duque, quote, "Children's health remains to be a priority of the department during the pandemic. Parents and caregivers are encouraged to have their children vaccinated because vaccines have been proven safe and effective in preventing life-threatening diseases in children." So this is another concern that's going on, that it's not just in the Philippines, but it's in a lot of other countries. I would say here in the U.S. also, that vaccination has been put on the back burner with the COVID crisis, and people are not getting their children vaccinated. And there's concerns that we're going to see outbreaks of vaccine preventable diseases coming up in weeks to months or longer. So it's a real concern, looking out for things like measles outbreaks coming up. And more help. There was fundraising for healthcare frontliners, which raised 92 million pesos, which is equivalent to about 2 million US dollars, I think. And it's called Project Kaigapay, a fundraising initiative that began last April to provide much needed personal protective equipment for the country's healthcare community. It's raised about $92 million in 92 million Philippine pesos in cash donations and received in-kind donations worth almost 27 million Philippine pesos, reaching 70 hospitals and medical centers in Metro Manila and other provinces. So there's a lot of help that's being funneled into the country. Well, people are trying to get back to work in the Philippines as they are around the rest of the world. But it looks really bad here where they're saying there's possibly 10 million jobless in the country. This is according to the labor chief. And it says some 5 to 10 million workers could lose their jobs due to the coronavirus pandemic and resulting lockdowns. This is according to Philippine Labor Secretary Silvestre Bello. At least 2.6 million workers were displaced permanently or temporarily as of May, Bello said in a Senate hearing on COVID-19 that swept the country of a little over 100 million people. The 2.6 million, that is the actual number of workers either displaced because of temporary closure or because of the flexible work arrangement. Our estimate is that we may go as high as 5 million. Now, during the Senate hearing on Wednesday, Senator Ralph Recto asked if it was possible for unemployment in the country to reach 10 million, to which Bello replied, "I hate to say it, but it's possible." So, yeah, big problem there. And there's also issues with, the Philippines is one of the main suppliers in the world of overseas workers. And it says here that the Labor Department also initially estimated that 150,000 overseas Filipino workers would lose their jobs due to the global health crisis. But the approximation has been since increased to 250,000 or even more. Bello said that 500,000 overseas workers have already applied for the one-time assistance of 10,000 pesos. So, yeah, you have Filipino workers that are in lots of places in the Middle East and Europe and in parts of Africa that are, it's possibly the biggest export in the country is workers, whether it be healthcare workers, laborers, all kinds of things. So that's a big deal because, a lot of these people are losing their jobs too. So it's quite a serious situation. And speaking of serious situations, something that kind of went along with the lockdowns. And it says, this Bloomberg report says, over 4 million Philippine families went hungry during the lockdowns. Right? So this is double from December amid lockdowns to stem the coronavirus outbreak. Nearly 1 in every 5 families said they lacked food. Pollster Social Weather Station said, based on phone surveys of over 4,000 people earlier this month. Half of the families were in the main island of Luzon, including the capital, which has been easing its lockdown imposed since mid-March. Almost all of these families said they got food aid from the government, the survey results showed. Some 205 billion pesos, or about $4 billion, were allocated by President Rodrigo Duterte's administration for cash aid to 18 million low-income families. Yeah, so if you have a lockdown and you only have limited supplies of food in your fridge and you can't get out to buy food, that can be very devastating. And I know in parts of Manila, Quezon City, and the like, they were going door to door, the government was, with packages of food for the population for this very reason. But yeah, a lot of people did go hungry because of the lockdowns. Anyway, that's kind of a review, a look at what up-to-date information about what's going on with COVID-19 in the archipelago of over 7,000 islands of the Philippines. And I'd love to hear what you got to say. Please comment below, subscribe to the channel, share it with your friends, and I'll see you next time on Outbreak News TV.